In your role, can you think about how digital care plays in the entire like healthcare ecosystem?
Absolutely. And I think it plays a very, very important role in the entire health ecosystem. But maybe we can level set and talk about what the current health ecosystem is right now. And this is not a groundbreaking revelation, but our ecosystem is more one of sick care, right? So you get sick and you go to the doctor, and the doctor prescribes you medication or tells you you need a surgery. And acute care for patients has come a long way over time, right? The last 100 years, infectious disease has been cured, and we can do knee replacements, and we can do all kinds of things to help people when they have gotten kind of down the line in terms of being sick. What we haven't done a great job at is really understanding how to help people prevent chronic conditions, and or if they get a chronic condition, catch it early and help them reverse it. And I think reversal is a term that some people aren't familiar with, but we really do know that lifestyle has the power not only to prevent, but also treat and reverse chronic conditions. So when we think about digital healthcare and what its role is in the health ecosystem, we're able to introduce these lifestyle-based technologies in digital care applications. We can improve access to care. People can have these solutions available to them 24/7 in the home, as you were saying, and be able to get feedback on how they are performing from a lifestyle standpoint on an ongoing basis. We're also seeing that if people are engaged in what they are doing and we're meeting them where they're at with their smartphone, that they're getting better outcomes. So we're starting to see that people are reducing their A1Cs, they're losing weight, they're improving hypertension because they have that constant feedback. We know that people go to their PCP, once a year, maybe twice a year, but having that feedback on a regular basis is really important. And then I would be remiss if I didn't say, coming from a health insurance company, this has an effect on our bottom line. If people are not engaged in their healthcare from the time that they are either diagnosed or even before they're diagnosed with a chronic condition, we're going to lose them in the acute phase and spend a lot more money.
So as you think about what Blue Cross of California is doing, what sort of digital care examples can you share? What have you maybe used in the past? What are you using today, and what is sort of your roadmap for the future? Maybe sharing some things. I don't know if you have things that didn't necessarily pan out.
Yeah. Well, I run a platform at Blue Shield of California called Wellvolution, and Wellvolution is a suite of primarily digital technologies and digital applications that our members have access to free of charge to help them prevent diabetes. Our full diabetes prevention program is a part of Wellvolution. We have diabetes treatment programs. We have obesity management programs. We are about to launch a GLP-1 kind of adjunct partner program for members who have applied for GLP-1 medications, whether they go on them or not, right? And so sort of helping people make that decision. We also have apps to help with emotional and mental well-being and mental health, tobacco cessation, and we recently launched this year, actually not that recently, it's almost a year ago, launched a suite of musculoskeletal interventions that help people do things like either improve mobility or actually do digital at-home physical therapy, which improves outcomes and adherence. I will say that for our roadmap, and I had a couple of slides, we don't need to pull them up, but I think for our roadmap, one of the things that we're looking to try to do in the coming year or so is, Wellvolution is it's a platform that sits adjunct to our member health portal. So if a member goes into the blueshieldca.com, they're going to click on like Be Well or wellness programs, and they have to click out to go to Wellvolution. They can single sign on, but it's an extra step. And so, when we launched this, it was sort of it was sort of a pilot or an MVP, and we really wanted to see if it worked. And now, 350,000 members are using it and growing. We have more and more conditions, and we're starting to see that patients and members are really responding to this idea of like a clinical marketplace, right? So we have a number of programs that I oversee that are lifestyle based. We also at Blue Shield have other digital care programs that sit outside of Wellvolution, and it becomes this conundrum for the member. Well, how do I find all of this? And so what I'm hoping to build in the next year is a clinical marketplace where we have push-pull capabilities. So in other words, a member can go to the clinical marketplace and shop for the right program for them, or in their Blue Shield CA member record, we can serve up recommendations to them based on the programs that we have. So really this bi-directional can meet the member where they are.
And so based on the usage and engagement with the platform, I would imagine there's some data that you've collected that have provided you with insights and ways to optimize or sunset or change what you're doing. But what are sort of the lessons learned based on a digital platform where you can actually capture data about your organization?
Definitely a lot of data that we've captured. I think engagement, you mentioned, is such a huge component. Like if you build it, that does not mean they are going to come. That means you have to do outreach to let people know that this is available to them. And you have to meet them where they are. And I've sort of said this already, but we have to be serving up the right recommendations to people at the right time. I think the other thing that is really important, and I know this was touched on earlier, is value-based care. So all of the digital, and not to get too in the weeds, but we contract with a partner is Solera Health, and they do all the subcontracting for us. So we have one contract, they have all the rest of the contracts with all of the digital applications that we have on Wellvolution. All of those contracts, the one we have with Solera and all the rest of them, are milestone-based pay-for-performance contracts. And that is critical because not all digital care is created equal. And you all know this, you've been presenting these fabulous solutions. Some succeed, some fail, some are great, some are not. And so we want the cream to rise to the top. So with the pay-for-performance contracts, we don't pay for use. Like it's not a fee-for-service sort of model. We pay for engagement and we pay for hitting clinically significant outcomes and maintaining those outcomes. All of the programs that we have on Wellvolution have remote monitoring devices attached to them, so we're getting that data back. I think the other lesson learned is, or just to kind of keep in mind, is like ease of entry and exit to market. And that was why we partnered with Solera Health. I don't know if any of you have ever worked at an insurance company. Maybe it's like government, but it moves very, very slow. So trying to do a direct contract with a health insurance company takes a full year. So if it takes a full year to contract with somebody, we're not going to be able to bring things to market quickly. So that model that we had where we were able to partner with a third party that could do the contracting more agilely than we could do it was critical for us.
And knowing that, obviously you have a Wellvolution, which is designed to support your members, but they're not the only ones involved, right? So you've got your organization, you've got clinicians, you've got different aspects of this. And and understanding the engagement that you have with your platform, with the people who actually need and get the care. Ideally, what would you want this digital care to look like as you move forward, and how would you, if you could have your perfect world based on your experience, what would that look like?
Ooh, let me design my perfect world. That is a lot of fun. So I think that it's been touched upon by some of the other speakers as well, that integration into the healthcare ecosystem. And so, one of the things that we can do a better job of is integrating with EMRs. And when I say we could do a better job of, I mean that like if each of these digital apps that people were using or digital care platforms could take their data and upload it to Epic Payer platform or whatever the EMR is, then the doctor has it. And I love what you said about people they're 42% more likely to talk to their doctor about it. I don't remember the exact statistic, but I think that that's so critical that if you are engaging in a program and you're talking to your doctor about it, if that data is also in your EMR, I know I'm the poster child for being the guinea pig of every digital health lifestyle-based app there is out there. And so I've done labs over here and I have a CGM that I wear here. And so there's all this data on me. And when I think about it, my PCP gets a fraction of that data, yet I get that data. So what I love about this digital health ecosystem, it allows the patient to be at the center of the conversation. And really, we are our own physicians. We are our own doctors. We take care of ourselves every single day, and we go to our doctor, once a year or twice a year. So it's critical that these health programs, applications, digital care can help the consumer become the center of that world. So I guess that would be the ideal,
And I also think, just generally speaking, that the lifestyle-based platforms are so important to really get that holistic picture. Obviously, pharmacotherapy, clinical surgical interventions are critical, but
Yes.
The future hopefully is going to be where these elements can come together, like the traditional with the digital, and to really provide that whole person approach to healthcare.
I'm so glad you said that, because I think that is one of the downfalls of our medical system right now is it is so specialized, right? So you were talking about fertility, Joe, right? You go to fertility and the fertility doctor is trying to get you pregnant, but they haven't looked at all of the rest of the conditions that you have. Or you go in for some kind of like sinusitis, and maybe that's indicative of, broad inflammation in your body, but that hasn't been diagnosed. We are whole people. We are not a set of individualized functions. They all come together and they all affect each other. So I think that when we're able to get all of that data into one single source, the doctors, the physicians, the specialists that help us through whatever condition can be a lot more effective.
Great. Well, thank you so much. We really appreciate it. Congrats with all your success with
Thank
Evolution.
you.
And
I have one question.
sure.
When you're looking at wellness apps, what type of data or evidence do you expect?
Great question. I think that the two things that, actually I'll say the three things. One is just sort of like customer satisfaction. If we're getting a lot of great information about how people love to engage with this program, that's fantastic. I think the second is outcomes on some level. So some of the programs that we interact with are actually clinical in nature. So they're measuring things like A1C and hypertension. So, improved A1C, reversal of type 2 diabetes, reversal of hypertension, reversal of obesity, et cetera. And then I think the other thing that is sort of ideal state, and really for a health insurance company, probably going to be the gold standard, is if there are externally validated ROI studies that suggest cost of healthcare savings.